Hi, welcome to The Sit-In. I'm your host, Martina Barksdale. Here at The Sit-In, you ain't got to get up. Here we focus on marginalized communities, giving them a platform, and specifically Black people where their voices can be heard. Here at The Sit-In, you belong, you are seen, you are heard. Today's episode, we are focused on mental health. We have three amazing guests with me today. Starting from my right furthest, we have Dr. Shambra Mulder. She's a licensed psychologist and owner of Abundant Living Psychological and Coaching Services. And in the middle, we have Allison Leggin, licensed marriage and family therapist and owner of Able Family Counseling. And we have Dr. Hargons, director of the Center for Healing Racial Trauma and assistant professor at the University of Kentucky. We have some guests with really great resumes, so let's jump right into it. We're talking about mental health. Have you all seen an increase of people dealing with mental health? And if so, why do you think that's happening?
I can jump in and say, no, I haven't seen an increase in people experiencing mental health symptoms, but I have seen an increase in people who are moving beyond the stigma and pursuing services for mental health. So I grew up in a community where it was low income, people had substance use and all kinds of mental health symptomology that was never treated. And now I feel like I'm seeing clients who would have come from those same communities, but they're showing up for therapy. They're excited about getting the help that they need. And where it used to be a really privileged location to get therapy, to seek that type of training and seek that type of help, now people are like, you know what, I'm gonna do what I need to do for my self-care, and I'm really excited about that.
I definitely can relate. I see a therapist about twice a month myself, and with you dealing with racial trauma, why do you think the stigma is lessening?
Because it's so pervasive in a covert way now, and it's always been. I mean, racism has been a thing in the United States as the foundation upon which we became a United States, but it's become, I think, for more people, more pervasive than they thought it would be. So it feels regressive, and they're starting to feel some of the trauma of that, some of the stress of that, and they're really excited about seeking services with a person who looks like them.
Like you said, within our communities and our cultures, racial trauma exists through generations, and you specializing in family therapy, what are some ways, if you would like your family to get involved in therapy or maybe go to a group session or anything like that, what some advice do you have for people looking for counseling on the family level?
A lot of people get the gift anymore, I think, of interviewing a therapist, and I highly recommend that. A lot of people don't know that they can do that. You want to know if it's going to be a good fit, right? You want to know if it's going to be a good fit. So what I do is I offer a 15-minute phone consultation or opportunity for people to just kind of get to know me, get to know what therapy might be like, ask some questions, but then in general, just do it, make the phone call, like actually take the time to do it. It's worth it, it's worth it. Anyone I get on the phone, I'm so excited for them because I know how hard it is sometimes to make the phone call, just make the phone call. So I highly recommend that.
Yeah, it's definitely hard to take that first step. And then with you specializing in children, what are some signs, or when do you know that maybe a children, like that they might need to see someone or you might need to talk to someone? Is it something that we should kind of have part of our everyday routine, or when are the signs?
I think that if we think about some of the things that affect adults, it affects children. So if we think about the opioid crisis, then that means more children are being taken from the home, more children are being neglected. And so I think in the schools is one of the first places people recognize the acting out. And then as they get older, sometimes the anxiety increases. That's not necessarily acting out, but when they're being pushed into college or pushed into areas. And so if you think about social media and all of the things that they're doing, it affects their mental health, the comparison. So I think that children is a good way because usually the signs will be there. And again, with the adult and the stigma, you know, we as parents sometimes think that that means we're not doing something right if my child needs therapy. And so we still have to deal with the stigma. I think children see probably therapy as someone to talk to and a great thing, probably hadn't heard a lot of the stereotypes or a buy-in of some of the stereotypes. And so I think they're more ready for therapy. They see it as something they get in school a lot of times, and it's natural. But again, you got to get the parents to bring them.
Right, because it's always hard because sometimes I hear parents say, or they're just bad. How do you know the difference between just a child acting out or that they actually need help?
Well, I think everything gives us information, right? So, you know, if you take a baby doesn't come out acting out, so to speak. And so everything is, if you take it back to a child who hasn't had trauma, who doesn't know, they're happy, they're go-lucky. So what happened? What changed that? And so a lot of times it's changing the environment, changing some of the discipline practices, but everything is information.
Right. And then we talk about therapy and how you see an increase and more people seeking it out, but it's still harder for people that cannot afford it. A lot of times people would like to go, but don't necessarily have the resources in order to go. What would you suggest, or how do we improve that?
That's a great question.
For me, and you know, again, if your child's in school, some of those services are available at no cost. The next thing would be community health, which is designed for, you know, to take your income into consideration. And then your insurance company is the next thing, because mental health is considered just like physical health, can be billed by insurance. I can't say there's a shortage of people, and it may take time to interview people and get the right fit. The idea that you might find a person of color might not be, but at the same time, I think it's worth the effort to continue to look. And sometimes people are doing telehealth, and so I think you can find someone, but it might take some time.
Right, yeah. It definitely took a little bit of time. I'm so thankful for the group NTOO where we're able to connect and share. So what has been some of your challenges with being a Black woman in this field?
Well, initially for myself, it was just getting my name out there and being open. My whole goal, my whole purpose was to see people that look like me. That was my whole purpose. And initially, that's not who I would see. I intentionally went to churches. I intentionally sought out my community to say, it's okay. Like, it's okay. Like, it's not what you think it is, you know. And a large part of dealing with my community, our community, I could see even that, like being able to say our community was getting past the stigma of, you know, being from Lexington. I'm a native of Lexington. People not telling you business. I know you. I know your people. Right. You know, so getting past that.
Who's your family?
Right. So being able to get past that and say confidentiality is of the utmost importance to me, and I understand that that is a big deal in this community, because Lexington, for all the ways that it's very large, it is very small. You know, and a lot of people. I came from, or I lived for a short while in Atlanta, and so coming back home was like, oh, you know. So one of the things that I would say I had to overcome was not seeing people that looked like me initially, and wanting so much to just wrap my arms around our community and say, come on, it's okay. So that would be probably the biggest.
I want to jump in a little bit because, to your point, I came from Atlanta, where there were several Black people who were therapists, and here I think there's a good number considering like the demographic makeup of Lexington, but you don't know, or you feel nervous about, for me, the dual relationships. So because I'm actively involved in the community and organizations, I have to let all of my clients know there's a possibility I might see you. And our ethics code says one thing about what dual relationships should look like, but if you're talking about seeing people who look like you in a small town, then it makes a difference that you say, look, okay, I might see you out. How do you want to approach me? I'm gonna allow you to speak to me. I won't speak to you first, But if you want to let people know, oh, that's my therapist and she's great, that's okay. I'll be on board with it. And if you want to walk past me like you don't know me, that's okay. I'm on board with that. So navigating those dual relationships and those multiple roles. What if we go to church together? What if we are in the same sorority? What if all of these things have happened? So, you know, just navigating that. But I love it because as Black women, I feel like, and that's who I see mostly Black women, but other people of other races as well. They're like, you know what? I want to let other people know I'm seeing you and refer you because I feel like we have a good relationship. And so I'm like, go for it, but you don't have to. And that's the thing I've been navigating.
Yeah, I think that's what's also been difficult for me because I have a therapist. I was telling you who my therapist is. And I didn't ask her to do this because of that. I have to kind of compartmentalize it. She's amazing, but it's just, you know, if I see her, I don't know how to act, but that's really interesting that you bring that up. But I know you all were talking about, you know, wrapping your arms around people, and especially women who look like you. And I feel like you all have done that. You're making strides in the community. But who has wrapped their arms around you? Do therapists have therapists? Does that therapist have a therapist? Can you speak a little bit about that?
Well, I'm a veteran, so I receive services at the VA, and she happens to be an African American woman, which is great. So yeah, definitely.
Oh, go ahead. So I have a therapist, and I actually, the first practice I was a part of, that was a private practice. My supervisor was an African American female. And so I was so grateful to have her to be a leader in practice. She wasn't my therapist, but she was my coworker. And so I was very excited to have that. But my therapist does not look like me. The therapist that I wanted and still adore is someone that's in the community, and we would have a dual relationship. So I'm like, I would see you again. She was my therapist in grad school, and I adore her. But I do have a therapist. It's necessary. Yes. It is very necessary.
I don't have a therapist now, but I started with one when I started my training in the master's program. And then at the doctoral level, I was like, to make it through this and to be healthy in my own mind and my own body, I need to take care of myself. And so if I'm gonna treat people and invite them to come to therapy, I need to do that for myself. So that was, my first therapist was a Black woman. She was dope. And then she was. And then I've had white male therapists, white women therapists, just depending on where my training was and where I lived. And I thought it was a beautiful part of the process because it helped me learn therapy from the client's position, but it also helped me unpack some of my own things that needed to be addressed in therapy so that I wasn't over-identifying with clients, was doing the work really well, and taking good care of myself.
Yeah, definitely. What are some things that people can do outside of therapy that can contribute to mental health? Because maybe this month an expense came up and I can't go to therapy till the next month. What are some things that people can do outside of the office?
I give people meditations. I have people do walking or other physical exercise. It's a mind-body connection, so it's not just you working things out cognitively, but we carry a lot of our trauma and our stress in our bodies. So yoga or dance practices, things like that. Talking with a colleague or just getting together in a group, social connection, that's therapeutic. Journaling is therapeutic. Writing poetry, journaling, all of those things. For some people, bibliotherapy is really helpful. So you might buy a book that's $20 as opposed to a therapy session that's anywhere from $25 to $200. And that might be really helpful walking you through a workbook or something like that. So there are a number of ways that people can engage in therapeutic practices that are not talk therapy.
She said everyone I was thinking. Every single one.
I feel stress does manifest itself physically. I've had experience with that as well. So talking to somebody, really working through the process has helped me. What are some misconceptions about therapy you would like to address or debunk?
The control factor. I do not control people.
I don't fix people either.
You have to do the work yourself.
Yes.
My therapist made me sign a contract. If I don't do the work yourself, I gotta do the work myself. And then I appreciate you all sitting down with me. What things can we look forward to each one of you in the future? It's a loaded question, but if you have a seminar coming up or you're speaking,
I think I want to speak to something you said earlier. She's talked about her practice model was to see a certain population. One of my practice models was to take Medicaid, which is very rare. And so that's one way for me to see people that don't have access to quality mental health or minority therapists. And so for me, it's going to, I built my practice to where I can see people pro bono or with Medicaid and also do some contract work. So for me, it's probably peeling back some of the contract work so that I can actually see the people and be accessible.
I really don't know. I'll be very honest. I practice from a Christian perspective. So as much as I embrace our community, that is also a very large part of who I am and how I practice. So I'm very open to what God has for me in that regard. And I've seen a vision of what he has, and I just want to see how he's going to do this. Yes. I'm willing. I'm willing. What about you?
So I've been seeing people through online platform for the Center for Healing Racial Trauma for several months now. And we're going to be opening the center, I think February 2020 is the date. But in addition to that, we're having a workshop series for Black women or Afro-Latino women where it's called Therapy. And we're going to be talking about decolonizing our coils, kinks, and curls, because there's so much trauma that we associate with how people told us we should wear our hair, what our hair means, what it means about our beauty and our self-worth. And so we're going to be thinking through that. And then I'm the advocacy and outreach chair for the National Urban League Lexington Young Professionals chapter. And so we're going to be doing a Black mental health panel. I would love for you guys, I'll give you more information.
I'm part of the Urban League Young Professionals.
It's going to be in February, so we haven't started to market it yet.
I'll be there.
But we're going to have a Black mental health panel during our Join Week. Just to put on display all the dope therapists who are here doing great work and allow it to be more accessible and for us to be able to connect with each other and connect with our community.
You all said it for me. I appreciate you all meeting with me. We had Dr. Shambra Mulder, Allison Leggin, and Dr. Hargons. Thank you so much. I appreciate that. Thank you for sitting in at the sit-in where you ain't got to get up. Here you are seen, here you are heard, here you belong. This has been the sit-in.